Hello, this is Jessica Shields. I am recording about discussion board 5, and this is a reply to Dena's post. I wanted to start out by saying great post. You brought up some great points, and I do agree that the stewardship would be a great thing for every hospital and every department. Knowing that the patients are being cultured first and knowing what disease they're treating so they can give the right antibiotic, the right time, the right dose, the right duration would definitely benefit a lot of patients in terms of hospital stays and health and healthcare costs, and it would help benefit the hospitals as well and their costs and stuff. And I definitely, you brought up some points about giving pre-op antibiotics, and I know every surgical patient gets their antibiotics an hour or 2 hours before the surgery starts, and I'm wondering if the antibiotic stewardship would cut that out, because I think giving antibiotics as a prophylactic is always a bad idea, but I mean, not always, but I think it would build up some resistance, even though they're only getting it for 24 hours or however long they're getting it. I still think it's somewhat building up a resistance. So I'm curious to see if the stewardship would cut that out. And you definitely brought up some good points about the Ebola and how it is mutating, and they should definitely not jump to conclusions and treat everyone before they know if it's Ebola or not. They shouldn't treat the symptoms, like if a patient comes with a fever or other things, they shouldn't jump to conclusions and just give them antibiotics. So you had a really, really great post this week, and I just wanted to reiterate some examples that I had come up with, because I actually used to work in the operating room as a surgical tech, and then I started out my nursing career in the operating room, so I have had some time in there, and I've seen many patients come back and they've had their prophylactic antibiotic, and then while we're doing surgery, they start breaking out in hives and going into respiratory distress. Even though they're intubated, they're still, the respiratory rate shoots up, and they're definitely in some sort of distress. But they've already had multiple other medications in addition to the antibiotic, so it's really hard to know if it was that antibiotic or not. So I think it is a risky subject to give everyone antibiotics before they go into surgery, but I mean, I understand why they do, because they are making incisions and messing around in whatever body cavity they're doing surgery on. So it probably is a good idea. I'm sure it's like a lose-lose situation in that, or a win-lose situation in that aspect, but that's it. Thank you.